Welcome to Hegde's Implant Care, reliable and predictable implant solutions for all. In the earlier session, I have already spoken about what are implants, what are the different situations we can have implants, who is a candidate for dental implants, how to manage deficient bone. Suppose you don't have bone, whether we can still place implant and how to manage such situations. So in this particular session, I am going to talk about what is the procedure for dental implants, the duration for dental implants, the duration for the entire treatment, how long it takes to get the implant treatment done, and what is the timing of extraction. Suppose I have to go for extraction and I want to get an implant done, what is the timing of extraction, whether I have to extract my teeth and come to the implantologist or I can do it simultaneously. Sometimes we come across cases where people ask us, I want an implant and the tooth immediately. Is it possible? What are different success rates for implants? These are the things I am going to talk about today. As you all know, like has been already told, you can see in the picture that when we place a dental implant, the procedure is to open up in that particular area. We place the titanium screw or the dental implant, we close it, we wait for some time, we wait for it to integrate, and then we place the crown. So what is the waiting period? How many appointments do you have in this dental treatment, in the implant treatment? To start with, the first appointment would be the surgical appointment, would be placement of the dental implant. Suppose, say for example, I have a molar missing, I have to place the tooth implant there in that particular area today, which probably takes about half an hour to place the implant, dental implant. We place the implant, we suture it back, and the patient can go back home. Once the patient goes back home, of course the suture removal is there. Otherwise, for the next 2 to 3 months, suppose I am doing a dental implant for a mandibular jaw, I would probably wait for 2 to 3 months, which means that the implant which has been placed inside has to integrate with the bone, with the process called osseointegration. It takes about 2 to 3 months for the lower jaw. And when it comes to the upper jaw, suppose I am placing a teeth in the upper jaw, same molar area, I would open up, I would place the implant, close it, and then the patient has to come back after 3 to 4 months. Now there is a difference. The difference is because the mandibular bone is a little more dense, it takes up fast, it integrates fast. The upper jaw, the density is little less. So when the density is less, the integration takes a little more time. So we give about 3 to 4 months, which means that the first appointment, surgical appointment, would be like say half an hour procedure on the first day, and then you have to come back after 2 to 3 months. So when you come back after 2 to 3 months, in this period, now what do we do for that particular area? Now the patient would never realize that the implant is inside the jaw because it closes well. Like how we have come in to treatment, before treatment, how the jaw was, the jaw is in the same state. Only thing is, probably if I take an X-ray, I know that the implant is inside. So from outside it looks just like pre-treatment. So you still have that empty space there, which we can manage with a removable temporary process. We can give a removable denture on that particular area for that particular time duration. So you can have a temporary process for the next 2 to 3 months. So after 2 to 3 months, now the implant is well inside the jawbone, it's well inside the tissues. The implant is not connected to the oral environment, is not connected to the outside. So we have to create a connection. So this we call the second stage surgery. That is the second appointment, second surgical appointment. So on that particular day, what we have to do is we have to open up that area slightly. Only the tissues, there is no major procedure there, probably 5 to 10 minutes of job there. We have to slightly open it up and we give something called gingival former, or something that forms the shape of the gingiva. So we call it gingival former. So we place this former and probably wait for about 7 to 10 days. So when you wait for 7 to 10 days, there's a beautiful opening, there's a beautiful connection between the implant and the outside, and a very nice conical shape you get, which we need a shape to connect it to the implant. So on this particular, once the opening is done, we make an impression, we send it to the lab, we get the crown. So probably after 4 to 5 days, we can give the crown. So entire procedure probably I would say in 3 steps. The first is the placement, second would be after 2 to 3 months where I have to open it up and make an impression. In about another 4 to 5 days or a week, we can give the crown. So this is the entire duration for the treatment as far as a single implant is concerned. So when you are doing a full mouth rehab, suppose all the teeth are missing and we have to place multiple implants, then the duration may vary a little bit more, probably a month or more, because we have to wait for good integration, we have to see the tissue levels, the condition of the bone, the condition of the soft tissues. All this has to be analyzed. Only once we feel everything is fine, then we go ahead with the impression and we go ahead with the final process. Now the next common question that we come across is this procedure painful? Is it painful? Can I get back to work? I have an implant today, tomorrow I have something, can I go to work? These are the common questions that we come across. So how painful is this implant? So Once we are placing, like I told you, it's a surgical procedure. The only thing we have to do is we have to give a local anesthetic. Once the anesthetic is given, generally people don't feel any pain. So I can compare it to a simple teeth extraction where you give an injection, a local anesthetic, and then you pull out the teeth, which I would say is little more traumatic than a single implant. The implant, the level of pain for implant would be, I would say, less than extracting a teeth. A very, I can say, almost painless procedure if you are given the right local anesthetic in the right place. So can we get back to work? Next question we come across, can I get back? I have a meeting in the evening and implant surgery in the morning. Can I get back to work? If it is a single implant, a simple case without any surgical complications, definitely if I do in the morning, afternoon probably you can get back to work. Now, unless we are doing multiple implants. Now, there are cases where we do multiple implants, we place implants all over we place 5 to 6 implants in the upper, about again 5 to 6 implants in the lower. Such cases, definitely I don't think you can get back to work on the same day. There might be some discomfort, I will not say pain, there will be some discomfort, and all that. We generally recommend at least probably for the next day you can go to work. That particular day you might need some time off for yourself because you might not be very comfortable, not that pain is there. There could be a slight swelling, very mild swelling if you are doing multiple implant cases. Thank you for a patient hearing.